must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hi, everyone, and welcome to the Healthcare Education Transformation Podcast. I'm one of your hosts, Stephanie Wyrock, and I'm joined by my co-hosts, Brandon Pohen and F. Scott Fiel. And today we're joined by Dr. Kyle Covington and Dr. Marcus Roll, who are both from Duke University. I'm going to tell you a little bit about them. So Dr. Kyle Covington is a neurologic physical therapist and the 2004 graduate of the DPT program at Duke University. And in 2007, he joined their faculty. He completed his PhD in educational research and policy analysis at North Carolina State University, and now serves as the DPT program's Director of Assessment and Evaluation. And then Dr. Marcus Roll is a physical therapist with a clinical focus on adult neurologic rehab. He is an APTA credentialed clinical instructor and Duke DPT faculty development resident, where he is involved in a variety of activities throughout the DPT curriculum. His residency curriculum is designed to enhance his training in educational theory, methodology, academic service, and governance. He's also dedicated to the future of physical therapist education and plans to be a competitive applicant for DPT faculty positions following his completion of the residency. And that leads really well into kind of what our theme is for this podcast today. We are going to talk about this Duke faculty residency, which is one of two in the country. The other one is at Nova Southeastern University, but that one is a little bit different model. So we're going to focus on the Duke faculty residency today. So first off, thank you, Kyle and Marcus, for joining us today. Thank you for your service and dedication to the profession. I know that you both are super involved within different initiatives in the APTA and the profession. For people who aren't aware, could you just give our listeners a little bit of background on who you are and what led you to be at Duke?
Yeah, I'll go first. So as you mentioned, Stephanie, and first, thanks for having us on. We're excited to talk with you guys today. As you mentioned, I graduated from Duke's PT program back in 2004 and worked for several years as a neuroclinician. And then came back to faculty and actually joined faculty in 2007 as the assistant director of clinical education. So pretty early on, I had a big interest in sort of thinking about education, how education works, both clinically and in the classroom. And that led me to work on my PhD, work at North Carolina State University. And through that process, really became interested even more in faculty development as well as assessment and evaluation, not only of students, but of program evaluation, as well as sort of thinking about how we develop ourselves as teachers. And at some point in that process, I began to have some conversations with my colleague, Carol Figures, who couldn't be on the podcast today, but co-directs the residency with me, about what could we be doing more to help people be better at their jobs and roles as faculty. And we were having that conversation with some people nationally, and I think some of those questions will come up as we go through the podcast, but that sort of led us to follow our interests and passions in improving the development of future physical therapy, physical therapist assistant faculty, and that's what led to the creation of the residency.
Yeah, and for me, I'm also a neuro PT. I practiced for several years, and as soon as I took a position, I had a student in the clinic with me, so I always loved that aspect of it. And that was in Los Angeles. And then I moved back towards the Durham, Chapel Hill area and worked at UNC acute care for a while. And I took a STEPS team from Duke, which is our students, which is a team of 4 members that follow you on for their early clinical rotations, and really loved that. So I've always loved working with students. And when I found that the Duke faculty residency was available, I applied for it, and because I just wanted to continue to learn how to educate a little bit better, because I think all PTs are educators, and so that was an important aspect for me. And also just to get experience. It's kind of hard to make that jump to academia from clinical work, and I hadn't quite had the opportunities that I had hoped for. And so I applied and was able to get it, and then I did the 2-year residency, and then I've been a faculty member here at Duke for a year since that time, since I completed it.
Well, awesome, guys. And, Marcus, it's interesting as you say that, because it's been interesting seeing how there have been so many residencies focusing on clinical aspects, but really not so many, at least until you guys, about non-clinical aspects. That's something that I really like. There is more of a need to kind of help make that transition from clinician to educator, or someone who's just finished their terminal degree to a full-out junior faculty member. And Kyle, I know you had kind of mentioned how the program started up a little bit in your previous answer there, but I'm just curious because I'm assuming that creating this and starting this up is definitely not an overnight process. So how did that go? How did that all fully get in motion to get that going to what it is now?
Yeah. So no, it was not an overnight process. That's for sure. As I mentioned, Carol and I had conversations over lunch one day about what kind of one of those big what if conversations. What if we could do something like this? We were lucky that we had a lot of support from our leadership at Duke to sort of go after it, and began to ask some questions at APTA and with the American Board of Physical Therapy Residency and Fellowship Education, ABPTRFE. And found out that some other people were having the same conversations, and there actually was a work group, a national work group, to petition ABPTRFE to make faculty development a residency option. So we joined that group and worked with that group for almost 18 months to 2 years through a pretty lengthy and comprehensive process to prove that it was a need in the profession. So there was a lot of survey work that was done. There was a lot of background research, literature review, and other research that was done. And we also had to outline what were sort of the necessary and needed parts of a faculty member's role that would be part of the residency education. And that same process is what any of the clinical residencies go through when they want to start a new type of clinical residency. So that was sort of one thing that was happening. And then simultaneously at Duke, we were sort of designing our version of what we would do in a faculty residency. So all of that probably took a little over 2 years. And then we welcomed the first resident, Paul Salam. And Paul joined us for a 2-year period. Our residency is 2 years long. And as part of his, the first is always a bit of the guinea pig, and Paul was gracious to be the first. And as part of that process, while he was doing his first and then second year of residency, and during Marcus's then first year, Marcus was our second person that joined us, we went through the accreditation process with ABPTRFE, which is another lengthy process. So by that point, ABPTRFE had decided they would allow faculty development residencies, and we had to go through the full accreditation process, which is a multi-step process with a lot of program evaluation, a lot of, as you can imagine, paperwork to demonstrate what we were doing, and includes an on-site visit from ABPTRFE reviewers to review the program. And we successfully jumped all those hurdles, and we're happy to become the first accredited faculty development residency with ABPT-RFE. And I think that was I should know this off the top of my head, that was Marcus's first year of residency. So what year was that, Marcus?
Oh man, that was 2 years ago. So 2016, starting into 2017.
Okay.
Awesome, guys. Yeah, I've been waiting for this episode for quite some time, and I'm super excited to have you guys on to talk about this because, as a recent graduate with an EDD, I literally have no idea what direction I'm heading and where I'm going. So this will be amazing for faculty development moving forward. And little known fun fact, Kyle and I both attended Wake Forest at the same time as well. So,
Go Deeks.
Well, Kyle's been making his rounds in the ACC. It's been great to see your journey, Kyle, and I've loved following everything you're doing. So, my next question is, what is the faculty residency accreditation process like? And what were some of the specific requirements that faculty residencies have that maybe clinical residencies do not?
It's a really interesting question because as we went through it for the first time, I think ABPT RFE was learning a lot about how to accredit a faculty development residency program and how that's different than accrediting a clinical program. ABPT RFE has one other non-clinical program, and that's the Education Leadership Institute, Eli, and I think you guys have probably talked to some Eli people before on the podcast, but we were Eli is considered a fellowship, and we were considered a residency in ABPT RFE world. So the accreditation process is sort of multi-stepped. You have your developing and candidacy phase, and then you have to have your first resident go through the program to prove that you can meet all the milestones. And as the first resident is finishing, that's when you can have the on-site visit. And the on-site visit includes it was a couple of days. It was a really great but somewhat stressful process of some of our colleagues in education coming to meet with everybody in the university. Is similar to a CAPTE accreditation process. Meet with our residents, meet with Carol and I as faculty directors, but also with a lot of our other faculty who are involved in working with the residents in their time at Duke. And they give a lot of constructive feedback and ideas, but the biggest thing that we found became an interesting sort of not challenge, but nuance and talking point is the mentorship hours. So mentorship is a big part of any residency, and the clinical residencies require a certain number of hours, and that's the same for us as a faculty residency. What was difficult is that it looked on paper as our residents had a low amount of hours, and we began to get in this interesting conversation with ABPT RFE accreditors about how, somewhat different than clinical residencies where the resident may be carrying their own independent caseload and then have a certain amount of hours or a day a week with their mentor. Our faculty residents are kind of always around mentors. And so we do have some formal mentorship time, but they're teaching in class alongside us, or they're coming to faculty meetings and asking us questions about what's going on. So that was the biggest sort of difference between the faculty residency and the clinical residencies, I think, from ABPT RFE standpoint. The other difference is that a lot of the clinical residencies have some written testing component or practical sort of ASCII exam component. And we actually, in our residency format, don't have written exams. There's written assignments that the residents do, but we really view it as almost an apprenticeship model. It's not, test-based, but they're proving their competency in a lot of content areas. But ABPT RFE was great about that and recognized that difference, and it was a really wonderful process. And Marcus got to go through it as a resident.
I know, and I think Kyle forgot the mountains and mountains of paperwork. I think we killed an entire printer here at Duke DPT, filling a room with paperwork for that accreditation visit. So
yeah, we had a huge conference table filled with paper to prove different things in the residency, and the site visit team left, and Carol and I just went in and started putting the paper in the recycling bin, and I thought Marcus and Paul were going to cry because they'd spent so much time helping us organize all that paperwork.
So I think that you guys make a really interesting point. And, Marcus, you got to experience what it's like to go through a process that that's required to get something accredited, and that's something that happens in all PT programs. So then my follow-up question to that is, what type of person should do a faculty residency program, and why should someone choose the residency route compared to just entering academia and learning from a qualified mentor instead?
I mean, I can answer that for what I find to be most important is, when you're a faculty resident, everybody knows that you're there to learn. I think when you start out in academia, there are going to be lots of questions that you're going to be a little bit afraid to ask, to think that you should already know that question. But my experience, everybody's willing to answer a question. Everybody's willing to help you along. I've taught in the neurosequence for a couple years now. Course director there is always talking about how he's making his decisions, what sort of things are happening, ways he's done it in the past. And if you're just a new faculty member, I don't think you're really going to have that type of interaction. It's going to be a little bit harder to seek out that exact mentorship opportunity, where sure, you're going to get mentorship on all the particular things about designing your course and things like that, but there's going to be a lot of stuff that you probably wouldn't be given. You'd have to really seek. But then also kind of the biggest part of the mentorship for me was, kind of the hallway curriculum, right? A little bit more of, just like Kyle said, of, kind of debriefing after a faculty meeting and seeing how the decisions got made and the history of years past and decisions that didn't go as well. So that's kind of a big thing, is a big reason to do the faculty development residency, I think, is kind of those things of, you're now on faculty and it's your opportunity to get things figured out with the help of your mentors.
Yeah, and I think Marcus is exactly right. I think we have had, with all of the residents, we've had now 5 different residents. Everybody sort of came into the residency with a different background and a different perspective. So, for who should do one, I think that's variable, but I think really the goal is to get that mentorship in the first 2 years guaranteed. We kind of joke, but it's really serious. I mean, the residents are protected from a lot, and they have this sort of barrier that is the guise of the residency, as well as their residency directors, that can prevent some of the typical things that can happen to a new faculty member from happening, but yet they are learning through that process. And I think what's been rewarding and maybe even a little surprising for us was that, the residency is about teaching and learning, but as much of that or more has probably been the experience the residents gain in dealing with student issues and managing faculty colleagues and working through academic problems, and, like Marcus mentioned, faculty meetings and committee meetings and those types of things that they get exposed and experience with, without having to sort of make the mistakes themselves that I think a lot of typical first-time faculty members unfortunately have to make, because it's a new process for most people.
And I think that protection is probably a huge part. First week of the residency, this is how you say no to opportunities. There are so many great opportunities that you can just be drowning in, all your great opportunities of helping this faculty member or taking on this project. So that was definitely one of the most important things to learn for me going in.
That's interesting that you say that. I just had a conversation with one of my colleagues yesterday, actually, where we were talking about the problem of overcommitting when you're a junior faculty member. Maybe expand on that, Kyle and Marcus, as far as does a new faculty member say no, and what should they say no to?
Well, I think as part of the residency, I have had several opportunities. Everything is presented as this great learning opportunity, right? And so the residency allows the resident to say, I'll have to check with my mentors. They're going to give, like Kyle said, they're in control of my schedule. So I get to, kind of debrief with both Carol and Kyle on, what I'm going to be putting into this project, what I'm going to be getting out of it, and just making sure it's in alignment with my goals and how I spend my time going forward. So for me, I think the residency kind of gets you the practice to figure out and kind of have that reflection process on, is this going to get me to where I want to be in the career? Is this going to help the program and the curriculum how it needs to be? And is it the most valuable use of my time? So I think that's definitely about a 2-year process in the residency to kind of figure out how that goes and what you should be spending your time on, and what's better left to other things.
Yeah, and I would say it's been fun Marcus has been our only resident that's actually stayed at Duke after his residency, and I think it's been fun to watch him in his first year on faculty because he's faced with that. Like we're not protecting him, and so he's got to make those decisions. But I will say that he makes them much more easily than someone coming right into their first academic job. I think because of the residency, I think it's a great question and a really tough one, Stephanie. I think it's hard. It's really hard for new junior faculty members to say no. And one, because, most people that are drawn to academics are go-getters. So that they're just by default not people that say no to a lot of great opportunities. But the other reason that it's hard to say no is because the hierarchy is built in a way, and the promotion and tenure process is built in a way where you kind of feel like you have to say yes to a lot of opportunities to continue to progress. And I think Marcus really hit on it, is this really fine line and nuance between, is this good for me and my progression, or is this only good for the person that's asking me to do it? And there are times you can't say no, or feel like you can't say no, but the real bottom line is, how is this going to meet my career goals? How is this going to advance me and give me fulfillment in my job? And that's hard to figure out. And I've been on faculty 11 years, and it's still hard for me to figure out some days.
Yeah, and guys, I think that's a really good insight, because I think that's a very important issue that often I'm sure does come up, and I think that's a good way to kind of discuss getting around it. And I'm going to go back a little bit, because you both had mentioned the accreditation process and kind of all the paperwork and all that's involved with AbTree and credentialing. And I'm curious, because I know I've heard from some clinical programs have kind of had some constructive feedback to AbTree, or I'm just kind of curious to kind of hear what your guys' thoughts are regarding the admin and the stuff you guys have to do from an accreditation standpoint through AbTree. Like, is it too much? Is it about right? Is it not enough? And what are some things that you think could better make that process more efficient and streamlined to best help provide the best feedback to both AbTree and the program?
Yeah, I think it's a great question, and it's one that's been talked about a lot, and it was talked about a few years ago at APTA's House of Delegates, and I think it's an ongoing conversation. A lot, too much, not enough is a hard question to answer. I'm probably a little slanted one direction because my job is accreditation and evaluation for Duke, and I trained CAPTE site visitor too, so I get the reasons behind why they want all this information, and it's to ensure a quality experience for the resident, and it's to ensure a quality product is coming out of programs that they put their name on. And I am a big supporter of that mentality. I think where it gets tricky is for us as a faculty residency, it's a little bit different. I mean, we have the exact same requirements, but we also sort of do this all the time with CAPTE too. So we're just in a cycle where accreditation is what we do as an academic program. And we have the resources for that. We have staff that can help with that are wonderful. And for us in the faculty residency, there's a whole module about accreditation. So when we have to go through our accreditation process, our residents help us do that, similar to what Stephanie was saying to Marcus earlier. On the clinical residency side, I think that's very different, and the clinical residents aren't going to need to learn about accreditation, so they don't necessarily need to help with that. And the clinical residencies are also trying to get patients treated, so I can imagine that it's at times a lot for the clinical residencies. And I also think that, I think our profession, both clinically and from a faculty development standpoint, needs more residencies, not less. So I think there's got to be some happy medium of ensuring a quality product, but making things efficient and cost effective so that we can grow residencies, not stifle them.
No, I think that's a really good point there. Marcus, did you have any follow-up to that?
I would just echo kind of what Kyle said. And then also, like he said, we're trying to figure out accreditation as residents here. And I think that's an important part for us to go through, especially, we had a small project as residents to code every objective and every syllabus to a CAPT standard, which
small project.
Yeah. So you can consider that across the curriculum of, that's all important stuff for accreditation, that for us to be striving to be faculty members, we really have to have our heads wrapped around all the nuances of how to do that and how to manage a site visit and things like that. Right.
And like you guys kind of said, it's kind of like finding the sweet spot between the right amount of work, but also being able to put out quality product. And it's kind of I'm going to go back to the residency here, specifically here. So for someone who's potentially looking into either applying for this residency, what are the absolute required prerequisites for someone considering doing this program? Like, what are the absolute must needed things that someone needs?
So I can only speak for us. I'm not familiar with the Nova Southeast's requirements. For us, we require a minimum of 2 years of clinical practice, and that's a strict minimum. And we require a DPT degree, and we prefer someone that has demonstrated concentration in a clinical area, not necessarily that they have gotten their certified clinical specialty, but just that they've shown some concentration, and that can look very different for a lot of different people. But that helps us on our side too, to slot residents into places in our curriculum. So those are sort of the hardline things that we're looking for, but we're also looking for candidates that have a demonstrated passion for education, a real ability to articulate why they are looking towards a career in education and academics, and also some experience teaching, whether that's as a clinical instructor or a lab assistant or continuing education. We don't expect for them to have huge amounts of teaching experience or be really great at teaching yet, because that's part of what the residency is for, but we just like to see that they've stuck their toe in the water, so to speak, and dabbled a little bit in that. When we are interviewing folks for the residency and talking to people about the residency, I'm always looking for someone that is flexible. This is not a job where you can expect to stick to a very specific schedule. It's not a job where what happened today is the same as what's going to happen tomorrow or what happened yesterday. Things are constantly changing, and things change by the minute some days, depending on what's going on with a student or a change that or we're making to the curriculum or the schedule. So we're really looking for someone that is motivated, highly motivated, and is a go-getter, but is flexible and can also receive a lot of feedback. I mean, this faculty residency, our residents, and this probably is a little different than a clinical residency, our residents are getting feedback constantly all the time in every direction from the program director, from higher up administration, from every single faculty member, and in our case, from about 200 students. So, they are getting a barrage of feedback and need to be able to handle that and take that in and act on it. And we've been really fortunate to have residents that thrived by doing that.
I think that's an important point. I mean, I know, talking to some of my friends who are faculty members around the country, one of the things they say is that when it comes time for student assessments of their teaching, sometimes they have to kind of take off, read them, and then come back to them, almost like you're getting a rejection letter from a journal or something, because sometimes that feedback can be a little bit hard to take, but overall they know that it's going to improve their teaching style. What was that like for you, Marcus?
Well, I think, feedback, I love getting feedback. And, one of the unique things about me in the residency is my undergrad degree is in creative writing. So that basically the entire undergraduate process for me was writing something and then sitting in a room and having people just tear it apart in front of you and tell you how bad it is and how you need to improve it. So I kind of come to that a little bit naturally. So I think, to echo what Kyle said, yes, we're getting feedback all the time. And I think the part that I was most surprised about was how honest and willing the students were to share in what their experiences were from a class or a course that you led. I had a couple of students that after every class I taught would send me an email right afterwards with reflections on what they thought went well and what could be improved on. And it was really constructive. And I think just starting that process early and getting used to it was really beneficial for me to kind of see that. And, I reflect on my classes immediately after I teach them too. So I think comparing notes were great to get different perspectives also.
What's been the most impactful feedback that you've received?
Oh, I think that might be a little bit off a little bit, just because there's probably the biggest thing is to have the course or the class have a hook and then go through it and bring it back to it, which seems like a little bit interesting feedback, but that's from one of our faculty members that has a theater background. And, each class is kind of a show, and to always bring it back, always be thinking about how this thing that you say is perceived and how that builds on the topic to kind of get our students to be from novice learners to really expert clinicians is what we're going for. So to be able to build on that and keep going to the level of progression that we're looking for has to be involved with every single class. And I think it's also important feedback that I went in and wanting every class that I taught to be the best class that student had during their entire PT school curriculum. Well, if you do that across everyone, you're kind of building yourself up that it's pretty hard to manage that. And you have to really say that not everyone can be the absolute best, but you can have a high standard that you're going through the whole time.
It's interesting that you bring in the hook. We just interviewed somebody on our podcast, Russell Woodman, who said he's been teaching for over 30 years at Quinnipiac University, and he said that one of the things that he does when he teaches is he got a lot of his teaching style from watching shows like Let's Make a Deal and just incorporating some of that theatrical entertainment value to the teaching has really helped him. So I think that's really interesting that what you said has connected to some of the other podcasts we've done.
And I think that's been fantastic. So every resident has to do an interventions lecture on stress management, which is kind of a hot topic, right, for students, but also for our patients. And so my hook was the stress management. Every about 15 minutes, I introduced an aspect of stress to our students. So, first year students, I had them have to look at, MPT board examination test questions, and they had to answer them well. They got about 10% of the class got them right, and then I showed them the amount of debt that they were going into for PT school and thinking about how that, if they didn't pass their boards, they weren't going to be able to pay that back immediately. So, and then we came up with stress relief topics and going back. And so you could tell that in the class, heart rates were going up a little bit. People were getting a little sweaty. And then we had to calm down, do mindfulness, things like that. So that's one of those classes that as we went through, they actually had to apply the intervention that we were talking about. I was kind of, using that hook to get in and get a bunch more, a more experiential learning for the students.
That really leads in well with kind of my next question. So you brought up student debt. One of the things that I think is maybe a barrier for people doing residencies, clinical or faculty, is cost. Obviously, you still get a salary as a resident, but it's significantly reduced from being a physical therapist. So for our listeners who maybe aren't aware, could one of you dive into the layout and the specifics of the program to kind of talk about the cost of the program and what the expectations are for the resident?
I'll start, and Marcus can give perspective as a resident. So for us, our salary, so our residents commit to a 2-year program. That was important to us because we thought that in academics, especially, some things only happen once a year. So we wanted the resident to be with us for 2 years to really understand the program well and get a deeper sense of what's going on. So they're committed to us. We're committed to them for 2 years. But the residency is only 4 days a week for us. So it's Monday through Thursday, and then all the residents have the option of doing clinical practice time on Friday or the weekend if they choose. That's set up independently by the residents, not by us as the academic program. So for us, our salary is equal to a postdoc salary, which is set slightly different at every university. But our residents are full-time, so they get university benefits and a postdoc salary. And then most of our residents have chosen to supplement that salary by working in the clinic at least 1 day a week as well.
Yeah, and I can say that's probably the biggest point of supplementing salary with clinical work. 1 or 2 days a week is very helpful to kind of pay the bills and do that sort of thing. And yeah, finances are always important. I think, I would love to be pursuing my PhD right now, but it's not, very financially feasible for me to do that going forward. And at least at this time, that's more familial issues and things like that, but still have a lot of debt I'm paying off also.
Well, I think that brings up, again, that actually, Marcus, leads perfectly into the next question here, just because obviously, as Steph mentioned earlier, the program's needing at least 50% of core faculty to have a terminal academic degree. And for both of you, I'm just kind of curious, are residents able or recommended to work on their terminal degree while they're in this program, or are they recommended to do it maybe beforehand or afterwards? And is there any financial assistance available to help them if that's the case? Because obviously, like Marcus had said, that the cost can definitely rack up with some time in a lot of these things.
Yeah, so for us, we've had a variety of different formats. So our first resident, Paul, was just finishing his PhD when he started the residency and defended in the first few months of the residency. All of our other residents have come in without a terminal degree and have different stages. One of our resident that just completed the residency this week actually started her work on her PhD during the latter portion of the residency, and that worked out for her, but that was done outside of residency time. There were a few things that she was able to dovetail with the residency. So as far as what the best option is, I think that's really personal. I know I can say Paul Salam, our first resident, chose to do the faculty development residency after his PhD because he just wanted more mentorship and experience before going sort of solo into a faculty role. But I also think for all of our other residents, and Marcus can surely speak for himself, the residency has provided a great opportunity to sort of figure out what they want from another degree. I mean, they're working with a faculty that has a variety of different terminal degrees. Some still don't have terminal degrees, but are core faculty. And so they really get a breadth of experience, which is another benefit of the residency for us in exploring what are their passions for further education themselves and how would that work and apply. We don't, it's interesting at Duke. Duke has generous faculty and staff education benefits, but they don't kick in until you've been at Duke for 2 years. So the residency ends at 2 years, so they can't get that tuition assistance until they're a third-year employee. So Marcus is coming up on being able to do that.
Yeah, so I can do that now, which is great. But you kind of have to front load it before you can get reimbursed for that sort of thing. But I would say, my going through the residency, you're very aware of where your strengths and weaknesses are. And my biggest weakness is, coming through on research, and I had a educational research project as part of the residency, but I just don't have those skills to be, producing multiple manuscripts, 5 to 10 manuscripts a year, coming up with constant research. And so that would be what I would be pursuing with a PhD, just to improve my skills with quantitative and qualitative research. But then again, that's a good reason why I decided to stay here at Duke, just because there's the mentorship there from Kyle, Chad Cook, people that can definitely help you with the research aspect, which is kind of my biggest weakness. I think, at least for me, that's kind of the point of I'm getting by right now, but understand that I'm probably going to have to go back to get my PhD eventually to remain competitive and stay at the current level that I want to.
So, guys, what tips would you recommend to someone just starting a faculty residency program? And are there resources in particular that either of you would recommend that they use?
Yeah, I think probably the biggest thing is just to go in with an open mind and kind of sponge as much information as you can, because you're going to be learning things that you didn't even expect to be thinking about. That was kind of my biggest thing, of understanding how being a faculty member works, and the teaching in front of the students, that kind of was the easy part. So easy to learn, easy to get feedback, but it's the rest of being an actual faculty member, going through that. And there are lots of books. We have residency curriculum, things like that is kind of guides you through the whole process.
Yeah, I agree with Marcus. I think that, my biggest tip literally on day one to every new resident is don't say yes to things without talking to me first. And usually the residents are like, what do you mean? And then by week 3, they're like, oh, I know what you mean now. But I think Marcus is right. It's the flexibility. And I think coming into it, most people that look at what a faculty member does in PT education, I think assume there's teaching and maybe some research. And I think that while that is very true, it's all the other stuff that people don't see. And so the residents, I think, even though we tell them this in the interview and their sort of upperclassmen residents talk to them about it too, I think all the residents are shocked at the amount of things happening behind the scenes and in meetings and in the hallways, and that are a huge part of the faculty member's role and responsibilities. And that's one of the big things. I think my tip is, be ready and be open to those types of things, and be ready to ask questions when it doesn't make sense, because often it won't, what's happening, because you don't have the context or the history or the experience. And that's been a great part of being a faculty resident director, is having those conversations with new and junior faculty about, okay, here's why we're making these decisions. Here's what just happened in that meeting. Here's how you need to react differently or next time to that.
Yeah, those are awesome insights, guys. And what would you say, based on some of the feedback that you've gotten, are some of the strengths and weaknesses of the residency program?
Well, yeah, I think the strength is probably, just like what we've said, the mentorship throughout the whole process, that you get some trial and error of everything, just how you portray yourself in a faculty meeting versus how you talk to students, or how you design your course syllabus, things like that. So that's the stuff that is really the strength, is that you're learning how to be a faculty member, where if you were going straight from clinical work into academia, you wouldn't necessarily have that. Didactic knowledge. I think probably the biggest weakness is that it starts on the calendar year. It goes January to December. And for me, as, a stressed second-year resident with a family, trying to think about academic jobs starting in the academic year, that was probably the hardest part for me, and the hardest part for a lot of the residents, is trying to take an academic job starting in January is a little tricky, going through and timing and finishing the residency. Now, it can definitely be done, and it worked out well for me because I ended up staying at Duke, but I know that's probably one of the trickier parts of timing just in general, that you're going to have that at any time anyway.
Yeah, I think Marcus hit on the strengths. I think some of the weaknesses, one other strength that he didn't mention that I think is huge is that, at least in our program, all the residents get faculty appointments for the 2 years that they're there. So they have a Duke University faculty appointment as a resident. So from a CV standpoint, they leave us with 2 years experience as a Duke faculty medical instructor level experience. And so that's huge for building a career. They go into a job having had 2 years of an appointed faculty member. I think the weakness is I never feel like, as a faculty member, I have all my own responsibilities, all my own courses, all my own administrative and research responsibilities. So I never feel like I get to spend as much time with the residents as I wish I could. And that's just sort of a personal thing, I guess. But there's always more conversations and there's always more mentorship that I feel like we could be doing. But there's only so much time in the day. And I miss them on Fridays when they're not there, because Fridays is one of my lighter days and they're never there on Fridays. But I think, we continue to tweak the curriculum and reorder things and find the best time of the year to do different things. But I think that's a strength too, is that we've remained flexible with the curriculum and with the assignments that the residents have to do. And we really try to let the residents tailor their own personal interests as those develop through the 2 years to the assignments that we have in the curriculum, which I think is another strength.
So how are you looking to continue to enhance the program?
I think every year the pool of candidates becomes bigger and more competitive as we've become more known in the faculty resident world. So I think that's one thing, is really taking a harder look at, if we've only got one slot to give, how are we giving it out, and who's that going to be? Nova Southeast is a completely different model where they can have multiple residents and it's all distance based. And I think that's also a great model, but it's different and appeals to a different sort of resident. But I think one thing I really wish is that more programs would look to do this, because I think it's so needed. And so we are constantly talking about how we can help other programs develop. So if there's people out there listening that are interested in talking to Carol or I or any of our residents or past residents, we really want to continue to improve our program and also improve and help those out there that may be interested in doing it.
And I would say too, just the flexibility of each new resident coming in, it's a completely different experience. I've been really surprised at how different it was for the resident before me versus me, and then the resident after me. And we all had different focuses, different things we wanted to do. But, even some of the things that Kyle talked about of being full-time academic faculty member, all these skills still progress, to being in the clinic still, and being in ACCE, managing clinical components in a large hospital setting. I think all the skills that we learn, could be really tailored to a lot of different things.
Totally. And guys, I know that, and we're talking about evidence and research. I know there really hasn't been a lot regarding just PT clinical residency and fellowships. I know a lot hasn't been done to look at that. And, I'm curious, because I know you guys would know this probably better than I do. Is there any evidence on physical therapy or even just other healthcare provider faculty residencies, and when it comes to student outcomes and other variables? Like, how can we, do we know how well we're doing?
No. We don't, is the simple answer. I think that's sort of the golden ring, right? Or brass ring, whichever ring, I don't know. We don't. We have some data about how our first couple of residents have done out of their jobs, but that's an N of 2 so far. And so you can't do anything with that really, from a statistical standpoint. But, so everything we have is anecdotal, related to how the residents that have finished compare to other brand new faculty members. Everything we have is positive, but it's anecdotal. And then how does that impact students, I think, is the real question, right? Just like in clinic, how do our actions impact clinical care improvement? How is better faculty development impacting student learning? And I think that's really the link that we need to be going after, but it's a hard one to figure out how to measure. But we keep thinking about it and talking about it, and we'll see where that goes. But that's another reason I think we need more faculty development programs, so we can have better research on the outcomes.
Yeah, I definitely agree with that. To continue to look at the outcomes, it's pretty tricky for the N of 2 now, but I think, just as clinicians, we're looking to be evidence-based with how we treat our patients, but I think I didn't really think about evidence-based teaching and how to use those pedagogical theories and things like that of just in the classroom and how you design your coursework for education. And I think that's kind of been the biggest push now is, we're going to use evidence in education and designing our curriculum, how students learn. And I think that's probably the most important part for me going forward is to pull on all that. And I think if I hadn't done the residency, I don't know if I would necessarily be thinking about that quite as much with every possible thing that I do.
Well, and I think that, educational research is hard to do. A lot of it's qualitative research. We're not really quite sure exactly what works and what doesn't overall. But, there's a common theme in that we all want to be better educators. We are all lifelong learners. So let's just say that someone has completed the faculty residency. What would you recommend they do after this continued development so that they can continue to live that lifelong learner model and continue to contribute to education?
Well, I think the biggest thing is still just like any new graduate going into the clinic and identifying mentors to go through and continue to hone your skills. I think it's been interesting for me to still seek feedback from people, even though I don't have those formal mentorship opportunities anymore. I just was talking with Kyle the other day about designing my syllabus and how I was weighting my assessments. And, I feel very comfortable seeking out those mentorship opportunities is kind of the biggest thing going forward is you have to always be pushing for that. And I think just building on the base of being a residency, the things that you're weak at and how to improve those. And I think that reflection is the key part of anything, to always be reflecting on how you did something and how you could improve it and how you could do it differently the next time. So always looking to be reflective on how you're portraying yourself and how you're teaching and what you're working on, what scholarship is always important to see what's the most important thing as you go through your career.
Yeah, I agree completely with Marcus. And I think it's really about humility, and Marcus is a great example of that. I think that so many new faculty members, and I was probably one of them, are so afraid to ask questions and appear as if they don't have all the answers, both in front of their students and in front of their colleagues who have been doing this forever and are big names in the profession. And it's really just about having the humility to say, I need help with my syllabus and I need some advice and I need some mentorship. And, that's no different than it is anywhere else in life. But I think that I think the academic environment doesn't value humility. And I think that those that can have it and can really ask for that help and seek out that mentorship in their, not only just in their first years, but throughout their career, are the ones that really will be the most successful. And I hope that we instill that in our residents in their time with us. And I think just watching Marcus in his first year out of the residency, he still is doing that. And our residents, just like our students, kind of keep in touch with us afterwards. But we were laughing the other day because Marcus sat down with Carol and I to work on a new class, and we're like, oh, it's just like old times. We're all just having a meeting, but Marcus doesn't get that formally anymore. But he's smart to seek it out, not only from us as his former residency directors, but from all of his colleagues, both at Duke and outside of Duke.
Yeah, and I think that just that point of always being humble and always being willing and not being afraid to ask for guidance when you need it is so important. You guys have said a lot of really helpful things that really provide some really good perspective on this residency. But of course, we got to ask our finale question here. So this is kind of our big cheese, if you will, since we're the Healthcare Education Transformation Podcast. And so our big final question is, if you could change one aspect of healthcare education, whether that be physical therapy or otherwise, which aspect would you change and how would you change it?
Well, I think I can probably give my answer for that is because it's something that we're trying to do here at Duke for quite a while, but really struggled to get it off the ground. And that's having more interprofessional education. I think if we could build that in with all the challenging schedules of all the different schools, we have MDs, nursing, PAs, all here at Duke with PT, and we're all focused on interdisciplinary care and teaching opportunities, but it's really hard to put together. I would love to see something put together that was a little bit more formal, a little bit working in teams to be able to build that to prepare for the healthcare system, especially even the didactic portion, but it would be great to have a clinical component where a team of different disciplines could be treating patients and working together to solve those, common problems in the healthcare system.
Yeah, I think Marcus's answer is great, and I would love to solve the student debt issue as one, but I'm sure you get that answer a lot. So I'll go with an answer that I already gave during the podcast today, which is more opportunities for postgraduate development, be that clinical residencies or faculty development residencies. I think we're just right at the cusp as a profession of physical therapy on that continuing to mushroom and explode. And I hope that other clinics and other academic programs will jump on board to really help proliferate the options for people out there to develop themselves, whether it's on an academic track or whether it's on a clinical track.
Well, this has been an amazing conversation with both of you. I know that our audience probably got a lot out of that. If people want to find you online or they're interested in the residency, where can they reach out to you?
So for the faculty development residency, you can go to Duke's Doctor of Physical Therapy webpage, and there is a link on the main webpage for information about the faculty development residency. And you can also email me directly at kyle.covington@duke.edu, or I'm on Twitter at CoveyJK, COVIJK, which is my Wake Forest email address.
And I'm also on the Duke DPT website, and I can be emailed, and all my email and office line is all right there.
Awesome, guys. Well, again, thank you so much for your time and insight and all the work that you guys do to really put out a quality program to really help contribute to making education much better for the students and for everyone. Thank you guys so much for coming on. It's always a pleasure.
Yeah, and thanks for having us.
Yeah, thank you.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.